Hello, this video is the second content video for 11.2. Primarily we're looking at the assessment process, and the previous video talked through the subjective information that as a massage therapist you would want to gather from your client. This video is looking at the more objective assessment that you would do. That will involve a variety of ways of gathering information, but they're a little bit different to the subjective stuff you've already collected. And both of these will enable you to then move into your interpretation stage, where you've gathered all the information about this client and you can decide what sort of treatment would best move them forward. So just a reminder that within the whole consultation process you're gathering both signs and symptoms associated with your client and the condition that they're presenting with. The previous section looked at the symptoms, that's the subjective stuff, and this objective content is the more factual, measurable method of assessment. And this is what you are going to gather. The subjective stuff was what they offered you as information about them. And it may be accurate, it may be incorrect. You have to be quite cautious with what your clients relay. Obviously, it matters that they describe what they're experiencing, but you want to double check everything and also see if with your professional experience you can observe or find other signs that can indicate what might be going astray for them. So objective assessments are going to come in 4 different versions, and you need to use all of these really within your consultation. And part of the reason why, and one of the reasons it's beneficial, is because you'll get different information, and you'll be able to, as I said earlier, double check what your clients have told you and see if there's an agreement with what you're finding out yourself and what you're investigating more directly. So objective assessment is gathering information about your client's physical condition, and you will do that in the consultation by doing some observation, which is actually quite passive. You're not going to get your clients to do anything necessarily, but we'll talk about what you're going to look for. You'll control the process by getting them to do a couple of postural assessments, mainly, I guess, looking at their vertebral alignment, their pelvic alignment, but also noticing if there's any variations in knees or hips or ankles, and how those are equal or aligned. You'll get them to do at least 2 active range of movement tests. You could do more than 2, but I need you to do at least 2 different active range of movement tests that are relevant. And you might incorporate into this some palpation, and that could be a sort of separate standalone thing, or you might do it alongside some of these other assessments as well. So let's look at the first one, observation. The things you might be looking for are these. So when your client moves or sits or takes off their coat, they may make noises, they might have facial expressions, and often those responses can indicate some kind of discomfort or pain. If they've got difficulty removing their t-shirt or for a consultation, they're probably not going to take their t-shirt off. But if there's an outer layer that they've got difficulty taking their coat off, again, it's a real indication of something being astray or some limited range of movement. Have a look, notice how they sit. So do they typically, without you prompting them, sit with good posture, nice and upright and balanced, or are they slouchy? And again, these are indications of perhaps some of the things might be causing some structural issues for them. Look at lefts and rights. So can you this will link in, I guess, with the postural observation, but can you notice any differences in different areas of the body? What I wouldn't probably recommend you do within this assignment, but what can be done is a gait analysis, which looks at how the person moves, and that can be walking, it can be on a treadmill if that happened to be in your practice. It's not that common for sports massage therapists, but they might notice how you walk, and again, this can show imbalances in particular. So these are the things that you might observe as part of your objective assessment. This is you looking for signs and clues. Think of signs as being clues, and you're a detective of what's astray. Remember, you might look when they arrive, before they're even thinking about what they're doing. how they take their clothing off, an outer layer, a jumper, a coat, how they sit, and possibly just how they move. And remember that in this assignment, not only will you have to do this in the consultation, you've got to be able to justify why you're doing these things. Why are you trying to notice these observations? How does it help you make better judgment in your interpretation stage? Again, you need to create your clients, and you need to therefore tell them if you need them to move difficultly or have discomfort in certain body parts. And that needs to be planned in advance. Okay, so the second thing that we're going to look at, or you're going to look at as the sports massage therapist, is for postural alignments and postural imbalances. And obviously, in order to do that, you need to know what is normal. So you should know from our anatomy course that these are the sections of the vertebral column, and actually you should be able to know already that there are natural curves in our vertebral column. They're meant to be there. So these two show a neutral spine, as in a vertebral column that is in the correct position. When you look posteriorly, so from behind a person, their vertebral column should be straight. Okay, so there shouldn't be any extra wiggles. And when you look laterally from the side, they should have a small cervical curve, a moderate thoracic curve, and a moderate lumbar curve. And those are the main areas where you're going to be observing for curvature of the spine. So here's our neutral correct position, and these are variations of that. These are abnormal standing positions or standing postures, and this is definitely stuff that you should look for. I would say that the ones that are more likely to be something that you could integrate into your clients is lordosis, the extra curve here, kyphosis, the extra curve in the thoracic, probably not so much scoliosis, possibly flat back and sway back. So flat back, this lumbar curve isn't there. Flat back, again, is a slightly straighter thoracic curve here, sorry, slightly straighter spine as well. Now, the next few slides go into more detail in all of those different types of spinal abnormality. I'm not going to spend too much time on them, especially a couple of them, just to show that obviously these curves exaggerate the bend where it shouldn't be. This is a lordotic spine, and it gives some indication here of the sorts of causes. So if your pelvic is tilting forwards more than it should be, maybe because you've got really short hip flexors or weak muscles, then over time, or you don't stand in a good position, then over time these curves can develop. So you will need to do more research into this. This is very much just a snapshot about what it is. Pregnant women, people with excessive weight, abdominal weight, might just find that weight loads them anteriorly, and therefore there's this excessive curve because they haven't got strong enough erector spinae muscles, back muscles down here, or quadratus lumborum is another one that's really important. Kyphosis, so this is the exaggerated thoracic curve, so where you've got an extra big sort of lump forward bend in your thoracic vertebra. Again, we spend a lot of times, a lot of our day at computers, driving, on our phone in particular, and that can lead to neck problems, which I can show you a bit later, but certainly this extra curvy thoracic spine. So that is something that could be incorporated into your clients in the modern world. Now, this forward head position, where your chin is too jutted forward, can also be connected with this one. So you've got an extra bend there, but also your chin and your head is further forward than it should be. And that puts huge amounts of strain on the muscles at the back of your neck and your shoulder. So the trapezius, for example, is one of the major neck muscles that stabilizes that neck, basically holds it back, and that can be really problematic. Interestingly, the further forward your head is, as in the head should be right, sort of aligned right above your vertebral column, because you've got this tiny pivot here at the top of your vertebral column that's balancing this heavy head. Your head is actually quite heavy. It's a couple of kilos, between 2 and 5 kilos. Now, if you tilt your head further forward, so your chin is pointing forward, that load is not above the vertebral column, and it's basically hanging forward, and it becomes heavier. The further forward your head is, so the further, let's say you look down and forward, the heavier weight, the more gravity is acting down through your head center of mass. And you can see by this data that the load of the head on those same muscles, little muscles really, gets bigger and bigger and bigger. So it goes from maybe 5K to 20K to 25K, which is a huge stress. So those muscles at the back get weak and long. Something definitely that you could incorporate with your clients. Flat back, so probably not one that maybe is relevant to us in terms of the clients you're going to create. Scoliosis, I'd say, probably not so much one that you're going to be realistically using. This is a sort of a lateral, sideways, kinky spine. Again, not one that's perhaps as easy for us to do. So those really, I'd say that the kyphosis and lordosis are the main ones that you could incorporate. You're also going to do, as well as looking at vertebral alignment, you're going to look at pelvic alignment. So your pelvis should be like this. Neutral looking left and right. The left and right side should be equal. So the top of your pelvic bones should be the same height. And obviously front and back, these front pointy parts of the bone, the pubis and this iliac spine should be in alignment. Okay, so that is a neutral pelvis. You're going to look to see if your clients have a neutral pelvis, and you're going to look from the side, and you're going to look from the front and the back. What might go wrong is your pelvis might be tilted forward. So this top bone, the top of the pelvis, is rotated forward. So we've got this backward angle, anterior tilt. This would fit with things like lordosis, I think. So if you had extra curvature here, it could be because your pelvis is tilted and there's all sorts of strains going on the muscles, or your muscles aren't strong enough. So this is, again, something that could be incorporated into a client. A posterior pelvic tilt is the opposite. So the top part of your pelvis is tilted further back. The front part is tilted further forward. So almost your pelvis has rotated backwards. We've got this, again, diagonal angle. And again, this is perhaps something that might come from having really short hamstrings. So for your second client, who's a lower body client, if their hamstrings are really tight, they're going to be pulling on the pelvis, pulling it back and down. And over time, of course, you get this discomfort. So again, something that could be incorporated into your client. To look at the height, the left and right side, so we were looking at front and back on the previous two, anterior, posterior. Now we're going to look at lateral pelvic tilt. Is one part of here we go, it's a bit more exaggerated, one side of your pelvis higher or lower than the other? And it shouldn't be, of course. So you can see that there are knock-on consequences. If you're a little bit knock-kneed on one side, maybe you've got a fallen arch down here, so this is really flat-footed. That brings your ankle in, so it inverts your ankle. This rotates your knee a bit inwards, so you're a bit knock-kneed on this left knee, which means that your pelvic bone, your pelvis is dropped on that side, and actually the consequence is your right shoulder drops. So even though possibly the cause was down here, the consequences are all the way up the body, and this chain of reaction occurs. So you're looking to see if, and this might link with palpation. So you want to perhaps, as well as look, you want to feel the top of the posterior. So if this is looking at the back of the person, get hands on, ask permission to palpate the top of these two pelvic bones, the iliac crest, and see if you can feel if they're level or not. Now, obviously, if you want your client, whoever's acting to be your client, to have any imbalance, you've got to tell them how you want them to stand. Don't make it too excessive. Notice a bit maybe. So this is again something that you could incorporate into your clients. These are some other things, and I've mentioned already being flat-footed. If you've got a fallen arch on one or both, so if you've got both fallen arches, flat feet, you're probably going to be a bit knock-kneed, and that will affect things upwards. If you've got really high arches, you might have more bow-legged, where there's an excessive gap between the knees. There shouldn't be that really. Some people are hypermobile, so their knee joint hyper extends, and they've got this kind of bow shape to their legs. So these perhaps are less relevant to you guys, but maybe the flat-footed thing could trigger other consequences that we've talked about already. So I'm not going to show them now, but there are 3 videos that give you some guidance on how to do both observational analysis of this postural alignment, but also how to palpate and what to feel for. And using these markers, it makes it quite obvious that there are imbalances on this particular model. So a few prompts for you to think about, just to remind yourself what you might be looking. Again, on your consultation document, you might want some prompts for yourself. It's a good idea to have diagrams for you to annotate and to mark, or maybe again to prompt you for what to look at. This could be something that you do to see if they are particularly rounded. So if they have got some kyphosis or excessive lumbar lordosis lumbar curve here, there'll be an exaggerated gap there, or there'll be an exaggerated curve there, and maybe it isn't possible to get them to have this, their thoracic contacting the wall or the door, whichever you want to use. So again, some prompts for what to look at. It's quite handy to use. So to summarize the postural assessment, which is more objective, you gathering signs about your client, plan in advance, use diagrams where you can, know what you're going to say to them or how you're going to instruct them to move into place. Make sure you obviously leave space to report and write and note your outcomes. And remember, you've got to justify why you're doing these things with your client in the distinction analysis part. Plan ahead any minor postural abnormalities you want your role play partner to show. Next we have number 3, which is active range of movement motion. So I'm going to first of all differentiate what does active or passive range of movement mean. If you ask your client to move a limb to test their range of movement, so all this massage therapist has done is told this client to lift their right leg from the flat position as high as they can. And the assessor would look and subjectively, I guess, measure that it was 60 degrees. That's their range of movement, or it might be less or it might be more. If you move your client's leg for them, it is a passive range of movement assessment. So if the client does all the work and uses their hip flexors or their muscles, whichever joint they're working, to do the movement, it's called an active range of movement. And if they are passive and just lie there or sit there and you move the limb for them, it's passive range of movement. You guys, you need to show that you understand both in your justification, but you need to do 2 minimum active range of movement assessments in your assessment. You need to decide what they're going to be, of course. Again, I've got a few links here to start you off. You're going to need to do the research on what assessments you're going to do. You'll find plenty on the internet, of course. Remember to cite and keep the links of where you find them. But think about in advance, what do you want to assess for your client? What do you want kind of to be wrong? And therefore, how can you measure it so that we can show later when you do a remeasure in your massage session, has it improved or not? When you do these active range of movement assessments, you could purely watch the athlete or the client and subjectively guess what angle you think they've moved in. So that would just be by doing it by observation. It's just a loose, you're subjectively putting a number on it, putting a figure on it to measure where they were at. Or you can use a more objective way of doing it, which this might be good, because you can justify why having objective measures is better. And depending on the test that you're doing, you can measure their neutral position, and then if they're doing a forward bend to look at hamstring and lumbar mobility, you could measure the difference between the same points. And obviously you can do the same on an extension. So this is measuring flexion, this is measuring extension. You can do it to the sides and so on. There are videos here that you can have a look at that give you some more clues. Again, you'll find other sources of information. So one, you can just have a look and subjectively put a number on it yourself. Two, you can use a tape measure and get some data, which is good to show change. Or another option is you use a goniometer. So again, this is objective. You obviously would set it in the neutral position. They do their range of movement. You measure it at the end of the range of movement. So here's a neutral position. That's what they can lift it to. That would be the angle that they have as range of movement in that joint for flexion. Again, this could be something you do. We've got a version of a goniometer that you can use. For all of these, though, what you ideally do need to know is what range of movement would you expect? What's normal? So having a sense of what to expect really helps you make a better judgment. Else you could think 90 degrees for shoulder flexion is good, when actually it should be somewhere up near 160. So you need to try and get a sense of what's good or normal range of movement. So that's the range of motion or range of movement. Plan ahead what tests you're going to do. You're going to do at least 2 active range of movement tests. Have diagrams in your form, or have space in your form where you can write results. Have diagrams to prompt you maybe. And then remember, why are you choosing these? What do you want your client to act like so you can prompt your role play partner? Check both sides, of course, because somebody might have really good shoulder flexion range of motion and then really on their left side and really poor on the right side, and that's a clue something is astray. So just before we go on to the last section of the objective assessment, I just want to remind you of muscle anatomy. So where a muscle attaches at the proximal end, at the end that is fixed and doesn't move, this is called the origin, and some muscles have more than one origin. This triceps has 3. The biceps has 2 heads, and then you have the muscle belly, typically the thicker part of the muscle. Obviously, some muscles are different shape. This is a very standard shape. And then you've got the insertion, the other end, the tendon that attaches at the moving end. So just some basic anatomy of muscles to remind you. Again, this is gastrocnemius, so it attaches at the distal end of the femur. So this is the origin. And then you've got the muscle belly. And then you've got this long tendon, which you will all know is called your Achilles tendon. And athletes can have all sorts of pains and trouble with not only the calf muscles, the gastrocnemius, the soleus, which is just beneath it, but also the Achilles tendon. And the techniques that we teach you for the client 2, which is lower body, will look at those. So what is palpation? Palpation is literally where you get hands-on and feel your client's bony landmarks. So you might feel for hard tissue. I mentioned earlier about doing the pelvic alignment assessment by feeling the hard tissue of the bones, but also in this case, a lot of massage therapists, they get a lot of information from what they feel. And so part of what you might do in the assessment phase of this is feel for tendons, feel for muscles. When you feel, you might feel little lumps or tight knots where, there's some discomfort. Your client may react. That's again a clue that there's maybe some inflammation. Obviously, look as well. So sometimes inflammation or the surface might be red or bruised, and you need to be cautious with that. If there are lumps and bumps, then again, that is definitely a contraindication that might need checking before you treat the person. But being able to identify, and obviously the more experienced you are, the better you get at knowing what should muscles and tendons and ligaments feel like, and then you'll be able to recognize when they feel wrong. You'll recognize it with through your palpation. So again, I'm not going to spend time on these. This is something that you can look at and do a little bit more research on, but these are the sorts of things that you might palpate. So little lumps and are typically trigger points or knots, and this is, where somebody's tissues are really tight or tense, and we've probably all had these in our sports career. But when you are doing the assessment and also in your actual treatment, you might feel some trigger points, some lumps, some knots, and you might adapt your treatment to deal with them when you find them. It's something that maybe you didn't know about in the consultation, maybe you hadn't planned to do certain techniques on, but when you find them, you might then change and adapt your treatment to respond to what you've found. Just something to think through and actually plan ahead for. So latent trigger points are knots that don't hurt unless you press it. Active trigger points are knots that can often feel pain even when not touched. And your client may report those, may say it hurts there, or when you're palpating, or when you're even treating in your actual session, you might find a latent trigger point. So a hematoma is probably less likely in your clients. It's really where you've had quite a severe knock or bruise, and the blood vessel has been more severely damaged, and there's blood released and tissue fluid released, and you get quite a nasty bruise, and actually sometimes it hardens. Do not treat this. So this is definitely a referral thing. Refer to a GB or somebody specialist. Definitely not something you would treat, but something you would observe to see if they had. So Justify, you would check and see if they've got any bruising or hematoma. If it's a gentle bruise, you might just avoid it. It might be a relative local contraindication. But if it's severe, you would refer them and send them to their GP, basically. Muscle strains. So if somebody comes and goes, oh, I've damaged my muscle, I've pulled my muscle. If it's grade 1, it's not too severe. 2 and 3, as you can see, are quite unpleasant, and I'm pretty sure he's got a grade 3 torn muscle because he's lifted something he shouldn't be lifting, and the pain would be incredibly severe. This is also contraindication. Do not do. If you treat damage like this before there's been sort of at least the starting point of the healing process, so I think that's my next, oh no, it's not. I'm just going to zip ahead actually. So, damage, your body has its own way of repairing. And if you treat somebody with an injury, an acute injury that's maybe only just happened or happened that day or happened the day before, and it's not done part of its natural recovery process already, you'll be doing more harm. So you do want to allow a few days. Check what you can find. I found a couple of different versions of how long you should wait before you treat a damaged muscle, like a torn muscle. It might be weeks, really, if it's severe. But do not treat anything that is anything near severe. If people have just got some damaged micro tears, then that might be part of what you do to help the process along. But you need to be mindful of those things. Last thing to mention is tendinitis. Now, this is anything itis is inflammation. So you often get this with overuse injuries. And so tennis players, tennis elbow is what it's called, where they're gripping the racket constantly or doing spins, then this tendon just gets overworked and it gets damaged, doesn't have time in between to be able to recover and repair, and therefore the damage gets worse and gets inflamed and obviously very, very sore. So this obviously is a repetitive inflammation. The top here shows varying degrees of Achilles damage. So normal inflammation, tendinitis, and here's a complete rupture. So this is inflammation. This looks like partial tears, tiny tears, and this is a rupture, which obviously would be very severe and you wouldn't be touching. So again, just something to be mindful of what people might present with. So that's the fourth and final objective assessment that you will include. Think about what you're going to do, know what you're feeling for, know what you want your client to present with. You need to anticipate that, of course. Palpation can be done on hard tissue, feeling for the bones being aligned or level. but obviously can be very much, as a sports massage therapist, about feeling the tendons, the ligaments, and the muscle, all the soft tissue. Be prepared to justify why you're doing this and, of course, what you want your client to present with and why you wouldn't treat based on what you felt. So we're nearly there. That's the end of the assessment phase of it. So we've done subjective. This video is about objective assessment, the 4 ways in which you will gather your own data. And then following that, you will go into interpretation phase where you will decide what treatment suits this particular client, and you will design your treatment plan. Okay? Make sure throughout all of this content that you know why you're doing the things you're going to do. Before I finish, it's just worth mentioning consent. So if your client is above 18, they can give their own consent, and what you'll basically need to do is you've explained to them through in the consultation, you've gathered information. At the end of that, if you think you can help them and they don't need to be referred, you'll say, great, let's make an appointment, I can help you. You then need to explain what the sports massage is going to be like, i.e. it will involve removing clothes. It might not be a pleasant experience. It's often quite uncomfortable, that you won't disclose any information about your client. You need to create realistic expectations of what you're going to be doing so that they understand the process. As an 18-year-old and above, they can give their own consent. If not, then you need to get their legal guardian or parent to give consent on their behalf. The young client can give assent, which means they give their permission, but you must also have consent from a legal parent or guardian. So that's really key, and it would be good if one of your clients was underage for various reasons, because then we can show other things we know. So again, you will find information about what informed consent is and why it's important and why you as massage therapists must get it, whoever you're treating. Here's one version of a consent section. So again, this should be probably the last section in your document where your client's going to sign. That you've already got their name already, but they'll sign and date it. This is quite wordy, so I would suggest maybe it needs to account for many of the points in this, but you could make it a little bit more concise. But this is the sort of information you need to incorporate that says they understand, basically. They've told the truth. They've told you about all their medical conditions. They understand what you're going to be doing. They take part freely. Sign it away. Lastly then, before you send your client off, once you've done your consultation, it's probably a good idea to guide them as to, when you see them next for the massage, what to do, what not to do. So obviously bring suitable clothing. It might be shorts that are helpful for them to wear. Males, actually, it matters what pants you wear. Lycra's not really ideal for doing massage, so you need to prepare them for what to come with and what to bring. But also even things like, if you're going to give them a sports massage, don't do mega heavy training the night before, certainly the day of. Don't eat huge meals. Don't drink too much just before they come in, because they're going to be laid on their tummy. You'll be treating them. It will feel unpleasant. You're likely to be using cream, so just warn them that they might want to take a shower. They might want to bring a change of clothing. Sometimes there's a chance they might feel a bit dizzy, just so they know what to expect. There we have it. All the assessment sections done, and I would suggest you do them in sections to keep it organized. Once you've done your consultations, then it's deciding what to include based on all of that information in the treatment plan. Just know as well that in your massage at the end, it would be a good idea to get some subjective and objective remeasures and further information so that you can gauge if your treatment helped them.